Hello. One thing that I like very much about Simple Remedies is their simplicity. I like the fact that even on the telephone I can tell a mother what to do for her child or a husband what to do for his wife and expect that they'll be able to follow these instructions very carefully and get an effective result. So because of the many things, the many advantages that Simple Remedies have, we hope that you'll join us for this program because we'll be discussing a number of simple remedies.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
I suppose there are probably as many remedies as there are people who practice them multiplied by 100, because everybody who uses Simple Remedies knows many. So I'd like to show you some of the ones that through the years I have learned, and I always enjoy learning more, and from time to time somebody will tell me 100 new remedies, and so I have a bunch that I would like to show you here. And one thing is something that you should have in any good home remedies kit or home kit for home remedies, and that's just a simple hand mirror. Here you can look at things that you cannot see just by looking directly at it. You can see on the bottom of the foot, you can see on the back, on the bottom, on the side, back of the head, and so everybody needs a good hand mirror in the home remedies kit. Now you need also a number of very simple things, some of the oils that we might call fragrances or essences. Some of those are really quite good. One used for headache is lavender oil, and a little cotton pledget wet with lavender oil and pinned to the pillowcase can help a headache that one goes to bed with at night. And some other oils. One that I like a lot is Melissa oil, or also called citronella, and it has a citrus smell. And the way to use it is simply to wet the finger and then put it on the back, behind the ears, because that's where little insects tend to enjoy being, and around the wrist can be put in dabs around. This is not related to citrus at all, except that it smells like citrus fruit, but it's a little herb called Melissa, and the oil is called Melissa oil. Then, of course, there is aloe vera gel and aloe vera plants. This kind of thing can be purchased in any health food store. This is a gel, and as you can see, it is quite gel-like. And this gel can be rubbed on burns and can be rubbed on scrapes, and anything that gets infected, that's a very good way to use that. Now this is wintergreen, oil of wintergreen. It's one of my favorite fragrances. I like very much the smell of wintergreen. And I use this a lot in massage oil. Wintergreen has a pain-reducing element, and if a person has a backache or a hip ache or a knee ache, and you put this in some mineral oil with half alcohol, so it's half alcohol, half mineral oil, a few drops of this oil of wintergreen, that can be so helpful for any kind of pain. So I like that for the home health kit for use in that way. Now, a lot of people get the problem that you know about called plantar fasciitis. And these little heel cups are very nice for that. A heel cup, what we do is to put the person's foot right in the heel cup, and they simply wear these inside the shoe. Now you would think such a simple remedy, could it possibly be helpful for the serious affliction that I have on the bottom of my feet, I don't think such a simple thing could help. I hear that kind of statement all the time, but I can assure you that these can be helpful. But something that I like probably the very best for this kind of affliction is a cayenne extract. And I don't have any with me, and I would not smell of it anyway, because it is the red pepper extract or cayenne extract, and it can set your nasal passages on fire when you smell it. So you don't want to just go around smelling it. But if you have plantar fasciitis, then it is simply painted on the plantar surface or the sole of the foot. And if you do it for 6 times a day for 6 days, then you can drop down to 2 times a day, and it often will help you to walk comfortably when nothing else will. So I like that very much. Now I have another thing here to show you, and that is how to make soy milk. I don't promote any of the commercial soy milks because of the fact that some of them do have substances that you cannot trust might be the most helpful for you. And so you can purchase these little soy milk makers, and many of them work by this process. They simply have a little mesh affair that holds the soybeans, and I have here a quarter cup of soybeans, and that's the amount that we need to use for this kind of equipment. This particular one is called a soy toy. It's one of the earlier ones, and there are many of these now, and you can use any of these that you like. They're all very good. In fact, some are improved over this one. And the little soybeans are the little round beans that you're very familiar with. So you simply put a quarter of a cup of the soybeans in this particular type of equipment. Then you can see that it has a blender type of blade, and this is then put in place, and the bowl of it can be filled either to the 1300 or the 1700 cc position, and I don't think you'll be able to see it, but you can tell that the inside is stainless steel, and it has a little marked off area where one can see the place to fill the hopper of it, and very nice. It cleans up very easily, and I like this very much. Once you have the water in, and you have you fix this on, and it has to go on in exactly the right way. Sometimes I have loaned my little soy milk maker to people, and they put it on with the spout out here. That won't work. It has to go here where it has the little connection, as you can see there. Then you close it down, very simply done, plug it in, and press start, and you're off and running. 20 minutes later, or 20 up to 27 minutes, I think this one actually requires 27 minutes from the time you press start until you're pouring up nice soy milk. It is delicious in flavor, and it's easy to flavor up or season in any way you would like. You can put a sweetener with it. You can even start with a juice. Don't tell the manufacturer that, because they don't recommend that, I don't think. You can even use rice in it to make rice milk. That also can be flavored up nicely. You should put a little salt in it, usually about a teaspoonful per quart. Now, with this kind of equipment, you can make a product very good for the bones, good for the heart, good for the arteries. It decelerates the rate at which people age. I like that about it. It also helps the eyes. It preserves our delicate senses into advanced old age. So there are many good things about soy, and I'm probably not even mentioning half of the good benefits of soy. So I recommend that you make your own soy milk so that you get the full benefit of the soy and not just a part of it, as you might with some kind of commercial product. or even get a product that isn't helpful at all, but is actually counterproductive for the health. Now, I have asked Rhonda Clark to join me. Rhonda, welcome.
Thank you.
Rhonda is one of my colleagues at UT Pines and works with me in lecturing, but also works as a counselor with our other counseling staff there at UT Pines. So I'm so glad you can be with me today, and I'd like to know what you're going to tell people.
Well, I wanted to share today a special hydrotherapy type of home remedy type of treatment.
Good.
It's called a salt glow.
Good.
And these are becoming popular in beauty salons, health spas, as an exfoliating treatment, which makes the skin very soft and smooth. But there's many healthful properties to a salt glow as well.
Yes, I like the salt glow for just toning up. If you feel a little bit tired or under the weather, if you know someone who knows how to do a salt glow, just feel marvelous. It boosts the immune system. You get over the cold or the flu a lot quicker, and I like it a lot. I've also seen it used for intractable epilepsy.
Really?
The kind where the person has a seizure, and then before they can fully awaken from that one, they get another seizure and another seizure. And in a field situation one time where there was no physician available anywhere, no drugs, nothing available anywhere, we had such a patient. So we put the patient in a bathtub and gave a salt glow, and the patient stopped seizing, and we were just thanking the Lord. Of course, we had a team of people in the next room praying for the Lord's blessing, and I'm sure that the Lord gave us His special blessing and assisted our simple treatment with success.
Wow. You know, I know that another group of patients that often can't take a regular hydrotherapy type of treatment, especially a hot treatment, are diabetic patients. Sometimes because they've lost the sensation in their extremities, and so we worry about burning them. But also, just metabolically, sometimes the heating treatments that we give at the Lifestyle Center increase the metabolism to a point that it's difficult for the diabetic body to keep up with that. But the salt glow is a wonderful way of increasing circulation and helping in the diabetic patient who can't take a regular heating treatment.
Yes.
So I've invited Miss Ariana Hartsfield to come up, and if she'll come and join us today, she's going to be our demonstratee.
Good.
And let me demonstrate this wonderful treatment known as a salt glow. The type of salt that you use in a salt glow is important. Table salt will be too fine and will not give enough of a rub or friction to the skin. And you certainly don't want to use the large rock salt crystals like people have made homemade ice cream with or used to clear snow and ice off of their driveway. That would be too coarse. What we recommend is known as kosher salt or a coarse salt. And this can be obtained really any place where people do canning, pickling. Those places sell this type of salt. It's a nice medium-sized grain of salt. And you'll notice as I pour it here in the basin, it has a nice, large crystal size to it. Each chunk of the salt is a little big, more than what you would see that you would sprinkle on your food.
Yeah, the table salt just melts and dissolves, and pretty soon you have no salt. You just have a solution.
A little saline glow.
A little saline.
And I've not put as much in the bowl here as you would if you were going to be doing the salt glow on your entire body. And that's the intent of the treatment, beginning with the extremities and working towards the center of the body, towards the heart, to begin with the rubbing of this salt onto the body. And so you might need a much larger amount than what I've put here in the bowl for our demonstration. You do want to wet this salt a bit to have it just wet enough to stick to the skin, but you don't want it soupy. There really will take very little water to moisten this bit of salt here for our treatment. Just a couple little drops of water may be enough. We'll see here. And as you mix it with your fingers, it actually helps you get a better feeling if you have the right consistency. And this looks, well, maybe put a little bit more water, just enough so that it'll stick without, you don't want it too wet. You want to help keep those salt granules intact as you can, because they're what's providing the friction, which is the beneficial component of this treatment. And Ariana, if you'd go ahead and raise up a sleeve for me, we'll demonstrate on your arm here the technique. And I'll put a little towel here under us so we try not to get too much salt all over everything. If you want to lay your arm a little bit more over on the top. There we go. And let's turn your hand the other way. I think we can see it here on the skin a little bit better. You want to take about a teaspoonful. Oh, thank you, Dr. Thrash. A teaspoonful or a little bit more of the salt into your hand to begin the friction. And it goes on the skin, and you rub rather briskly.
I feel good?
It might sting just a little, actually. And you want to get it more, and then as you run out, you just get a little more. And when you're doing this on yourself, a nice circular motion like this might be good, but you want to try to get a nice red glow to the skin. We'll do one more time here.
And you need to watch the patient and make sure they're not, you haven't taken off the top layer of skin.
You can see how her skin is pinking up very nicely. It's looking quite pink, and this is the intent of the treatment, is to be very warming, very stimulating. And when you're doing it on yourself, again, start with your arms, working up, get your chest and abdomen. If you need any help getting your back, you can put some of the salt solution in a towel and then scrape along your back. And I guess we can start brushing this off. Or I also brought along a back brush. This is something that you could use to just put down into the salt solution itself and really get it full of the salt, and then could do your own back with this. The ending of the treatment is to just rinse off in a tepid shower and get all of the salt off your skin. You don't want to leave any of that on your skin at all. So rinse off well, and Miss Hartsfield will be rinsing off here as she finishes helping me. And then rest. It's nice to rest for a bit after the treatment if you can, or you might have to just go on to work. So if you take it to help yourself liven up, know that it might make you a little sweaty or just stimulate you enough. Don't let that surprise you.
It is a stimulatory treatment, but then after a while it is relaxing. So if you go to work, you might fall asleep over your keyboard. Now I'd like to thank you so much,
you're so welcome.
Rhonda.
Thanks for
Appreciate
having me.
you showing the salt glow. It's an important treatment, and I like it very much. Now I'd like to have Ariana help me with a couple of other treatments. One is this lumbar roll, which is for a very large person, but it can be very helpful. And if you'll hold your arms up, I'll just put it around, and it can be just, maybe I'll just go ahead and put it all the way around, and hold that right there for me. And I'll just put this right here, and then around to this side. And the roll should be, the lumbar support should be quite tight, as you can see here, firmly tight. And that is quite helpful. And people who are very active, who lift things, or who are lying in bed a long time, and they begin to get some difficulty because of lying in bed, the low back begins to hurt. For these individuals, if they wear one of these, it can be very helpful. People who have to lie in a hospital bed with the knees up, Ariana, I need you for another thing, so don't go away. They have to be with their knees up for a long time and the bed is propped up. Sometimes they will get a low back pain as well. Now, Ariana, I'd like to show this little device right here. While this is a massage assistant, it is, and it looks as if it's a little spider. It's a little thing made of wood, so if you'll turn your back, this is so nice. Does that feel good, Ariana? Isn't that nice? This just rubs across sore muscles. And by the way, massage strokes are more for muscle than they are for bone, so don't get too vigorous with a massage stroke that comes across a bone like that. You have to be very careful not to do that, but to stay with the muscles. And a person who is not a very big person, as Ariana is not, then you don't want to, they are not very hefty. Coming down across the vertebral spines will not be pleasant for such a person. So you should go to one side or the other, but not straight down the spine like this. And of course the muscles that are down here and the muscles that are on the arms, these can be nicely worked with a very simple thing such as this. Thank you so much, Ariana. Appreciate your being my helper. Now, another thing that I like to see in the home health kit is an eye wash cup. These are available from pharmacies. They just have a little depression in them, such as this, and this depression can hold several kinds of fluid. Saline is one kind of fluid that this holds, and the saline is made up with 1 teaspoon of salt to 1 level pint of water. Now, a pint is 2 cups or 1/2 quart. So either way, anyway, you can measure 1 teaspoon, 2 cups of water, and that gives saline. Fill the cup with the saline, then it is put right against the eye in this fashion, and while one is bending over or up like this, one can bat the eyes multiple times, and that, of course, will cause the eye to get washed out. It's very good in cases of conjunctivitis or in cases of something getting into the eye. So that can be most helpful. Now, for women, I recommend that they get some little device such as this, a little barbell for women. And I have 2 of these right at my desk. And no matter what I'm doing at my desk, if I'm only using one hand, then I use the other hand. If I don't have to concentrate too much with this hand, say with writing, then I use this hand just to work my hands up and down. But I really like to use both of them. So if I am sitting talking with someone on a speakerphone, then I can be doing all sorts of things with dumbbells, and they don't have to know that I'm doing my exercises while I'm also talking on the telephone. That can be very nice, and of course all sorts of curls can be done in this way. So just over the head or around behind the back, anyway, that you can find to move the dumbbells. This exercises different muscle sets. Now, another thing that I like to have at my desk for long time simple things that I do that don't require too much concentration is work with this. So you just work with this a bit, and again, this can be stretched in any one of many different ways. You can stretch it up and do it on diagonals in this way. You can put it over the back, and of course it can be done this way. You can do it fast or slow. And when you do it fast, you get a different kind of reaction than you do when you do it slowly. So in all manner of ways you can do this. Even at times I have had to watch videos or do some kind of work of that nature, so I just hook it over my toes and stretch it out in that way, one after the other, and it's easy to find different ways and different muscle groups that can be exercised with this kind of thing. Another kind of exerciser is this kind of exerciser. I'm going to tell you, although I don't expect you really to believe me, that working out with a little hand exerciser such as this can help you not to have glaucoma. Now, glaucoma is an increased pressure inside the eyes, which can cause blindness. So, of course, it's quite serious. And when I read this first in a medical journal, I thought, it was the Journal of the American Medical Association, and I thought, oh, the journal has become spiritualistic, because what about working out with a hand exerciser such as this could keep a person from getting glaucoma, or could treat the glaucoma if you already have it? And the idea is that as you work out with a hand exerciser such as this, it increases the carbon dioxide in the blood just a little, and that relaxes the tension inside the eyes. Now, anything that relaxes the tension inside the eyes will also relax the blood pressure. So if a person has high blood pressure, working out with one of these little hand exercisers can be very helpful. And so people who do spend a lot of time telephoning, they can, when it's not too distracting to do some little exercising such as this, one can simply work out with a little exerciser such as this in times of this kind of stress. Now, here is another thing that I like to see in people's home health kit, and this is a venomous bite extractor. Now, the venomous bite extractor can be used for a number of different kinds of venomous bites, and the instructions usually come with such a kit, and you can see this kit has a little shaver in it to remove hair. And the hair is sometimes in the way of the extractor, so the hair may need to be removed. So the little razor and then the extractor itself with the little cups. And here is the largest cup, which could be used for a small pit viper, I suppose. And it's simply fastened on in this way. And then the plunger is pulled back, and with this put on the place where the person was bitten, and then the extractor used to to extract the venom. And it's not difficult at all to use this kind of equipment, but it can be quite effective. Now, once you have extracted the venom, a lot of people feel, well, what I need to do is to cut the area. But that isn't good. That's not the best thing to do. The best thing to do is to use the anti-venin, which you can get at almost any emergency room where they treat snake bites. And you can also use charcoal. If you have cut the area and you put charcoal on a fresh wound, you will get a tattoo. It's inevitable, because the charcoal will become enmeshed in the fibrous tissue or the skin or the epidermis, and it will remain there forever. So it's best not to cut, but rather to use other things. The cutting has not been shown to be effective. Then for brown recluse spider bites, you can also do an extraction if you get to it right away, and then put the charcoal compresses on, or soak the part. If it's a part that you can put into a charcoal bath, you can put it in a charcoal bath and change the charcoal water very frequently. We like at first to change it every 30 minutes. That probably is not necessary, but it gives us something to do and makes us feel that we're trying our very best to keep the person from getting a major slough from a brown recluse spider bite. Hope these remedies have been very helpful to you. May the Lord bless you.